Hello everyone, welcome back to our channel. So briefly we are going to discuss about arrhythmias. So what is an arrhythmia? It refers to the electrical disturbance of the disturbance of the electrical rhythm of the heart. Yeah, disturbance of the electrical rhythm of the heart. Okay, so what are the causes or etiology? We are going to classify them into 8 groups. Yeah, the first group we are going to have is due to electrical imbalances. That is, we can have hyperkalemia or hypokalemia, that is increase or decrease in the potassium levels in blood. 2, we are going to have the disturbances with the calcium ions, that is hypocalcemia. We are also going to have hypomagnesemia. So these 3 electrolytes, that is potassium, calcium and magnesium, can cause arrhythmias. Another factor we are going to look at is the endocrine factors. So here we're going to look at the thyroid gland, whereby if we have hyper or hypothyroidism, it can cause arrhythmias. And also we have diabetes. You know, it's an abnormality in the endocrine system. Yeah, the pancreatic beta cells. Yeah, insulin and all that, depending on the type of diabetes. Another etiology, the third subgroup you're going to have is drugs. We can either have prescribed drugs or these illicit drugs. So for the prescribed drugs, we can have drugs like S inhibitors. We can also have, beta blockers, calcium channel blockers, digoxin, antiarrhythmic drugs, especially the class 1 and class 3. Then under the illicit drugs, we can have alcohol, we can have cocaine, we can also have amphetamines. Yeah, these pronunciations. Anyway, for the fourth category, we can have abnormalities in the cardiovascular. Yeah, so one, we can either have ischemic heart disease, cardiomegaly. We can have inflammatory conditions like myocarditis, pericarditis. We also have defects in the valves, that is valvular heart defects. We can also have hypertension, that is high blood pressure or heart failure. The other subgroup is pulmonary causes. We can either have pulmonary embolism, pneumonia, or COPD. Yeah. So for the gastrointestinal disorders, we can have cholestatic jaundice. Yeah, the obstructive one. Okay. So for the catecholamine excess or sympathetic overstimulation, we can have pheochromocytoma or stress, that is stress from sepsis, that is sepsis. Yeah, hypovolemia, post-surgical state, hypothermia. Others, that is class 8 now, they're not classified in any system. So we can have genetic abnormalities, we can have sleep apnea, smoking, stress or anxiety, caffeine, hypoxia, acidosis. So what are the symptoms of cardiac arrhythmias? We can have asymptomatic cardiac arrhythmias, and some symptoms include dizziness, syncope, chest pains, fatigue, shortness of breath. We can also have urinary urgency. All right. So can you just comment what have you grasped in today's session? It was just a short one, briefly about the etiology and the clinical symptoms. I know you're not going to read again about clinical symptoms and etiology of arrhythmias. Yeah, I'll do another video of the mechanism and all that. Yeah, so see you next time. Kindly subscribe. Hmm? Subscribe to this channel for more content. See you next time. Bye.